Hello everyone, I am Dr. Godwin, Deputy Medical Superintendent of Ayurveda Gram, which is the most awarded wellness center in India. We have been awarded Wellness Center of the Year last year by ASSOCHAM and Federation of Indian Chamber of Commerce. So I am here to talk about one of the most difficult diseases in the medical field to manage, which is called rheumatoid arthritis. It is one of the most dangerous inflammatory arthritis, and in the modern science there is not much hope because of the autoimmune nature. It usually affects the bones and tissues, and in the advanced stage even the patients can get deformities in the finger joints, in the wrist joints. Even it can make the patient immobile. There are some cases where I have consulted where the patient is almost bedridden, right? So in Ayurveda, this disease has been mentioned in the last disease in our Chikitsasthana chapter, or the treatment principles. Okay, so that means the severity of the disease is more serious in nature, and it can affect all the 7 dhatus. It can even eat away the bone tissues. That's how the deformity in the bones can come. So according to Ayurveda, the causative factor for rheumatoid arthritis comes from both physical factor and also the mental factor. In the physical factor, the most common causes is indulging in unwholesome diets, food habits which is not very easily digestible. That creates ama. Ama is a Sanskrit term for indigested food material, which develops in the Agni, and then it accumulates in the system. It travels, absorbed into the system, circulated all over the blood, and causes inflammation in the joints. Typically, the rheumatoid arthritis affects all the major joints, including the knee, ankles, and wrist and fingers. The most common factor is the joints in the finger joints. So what we do in Ayurveda is we have to reverse this digestive system factor, which is the most common cause, which is the ama. So when a patient comes to us, we first try to correct their diet and also try to digest whatever already ama accumulated in the stomach. Thereby we reduce the inflammation, and in certain stages where we can apply the oil when the inflammation comes down, when there is more vata nature, when the pitta nature comes down, then we can apply oils and then take forward to the next panchakarma treatments. So in most of the cases, it is described in Ayurveda as vata rakta. Vata is a cold factor and rakta is a hot factor. So that's why the combination is deadly and it's very difficult to manage. So most of the Ayurvedic doctors find it difficult to manage when both the factors are aggravating at the same time. So in our text, it's amapachana, we call it as digesting the tissues, which is the most initial step for any rheumatoid arthritis condition. Once you digest the ama, the inflammation comes down. So I have had experience of treating most advanced stages of arthritis, where we had patients who had come on wheelchair with a big swelling in the knee and not able to stand, not able to sleep, completely on painkillers. So we were able to admit them and then treat for 28 days of panchakarma treatment in Ayurveda Gram. After the 3 weeks, 4 weeks of treatment, the inflammation has come down. The patient was able to come out of wheelchair, start walking better. Again, after 6 months, one more course of 21 to 28 days of panchakarma treatment was done. With that, we were able to arrest the further damage of the tissues and joints, so that we can actually save some more joints. So if the patient comes to us in the first and second stage in the initial rheumatoid arthritis, we will be able to help them in a much better way. So that's what I wanted to discuss about the rheumatoid arthritis. Thank you for your time.